Hi, my name is Brianna Banks, and this is my ethics oral presentation. According to the textbook, ethics is a philosophical study of morality. Morality being like good or bad, right from wrong, and then the kind of behaviors that we show based on these ideas. So far during the course, I've learned that there's three major divisions in ethics, and these divisions are examples of different ways to approach certain situations. The first one is the metaethics, the study of meaning and logical structure of moral beliefs. So kind of what somebody is saying and like based on their language, like what is right from wrong or good or bad. Normative ethics, so the study of the principles, rules, or theories that guide our actions and judgments. Treating others like how you would want to be treated. So if you would want somebody to treat you a certain way, then you should treat somebody that same way. And then applied ethics, so the application of moral norms to specific moral issues. So doing such giving the best care for like your patients. Also learned that there's 4 elements of ethics. So it's preeminence of reason. So it's basically like knowing when to use our feelings. So kind of putting our feelings aside based on certain situations and using critical reasoning to try to take our feelings based on what we kind of know and understanding that situation. The universal perspective. So it's thought that if a moral statement is applied in one situation, that it must be able to be applied to all situations that are similar to it. And then principle of impartiality. So everyone is equal, so it must be applied in all moral situations. And the dominance of norms, so not all norms are moral norms. So pretty much like the gist of the class so far that I've learned is ethics is all around. Everybody uses it. I found really interesting the Socratic method, like asking and answering questions to like draw out like your ideas and like the truth. Like I could see like that being implemented in nursing to like kind of like even with coworkers, like saying like spitting ideas back and forth on patient care. You may think you feel one way about something, and then somebody asks you a question, and you could feel some different way. So, of course, my major is nursing. So, ways that I could use ethic in the field. I would say applied ethics could be used, definitely. Like I said, knowing like with certain situations if you're giving the best care for your patient, because that's what nursing's all about. You want to give the best possible care to your patients. And normative ethics, so like kind of knowing right from wrong in certain situations and to be able to make somebody comfortable. If you're discharging somebody on time, giving proper medications, things like that. Even with like coworkers, I can see where it can get a little wishy-washy because as a nurse, you need to report any unethical things happening in the work area. So, I mean, not everybody thinks the same way. So, someone's might not think other things are morally correct like you do. So, kind of being able to differentiate between what is morally right and what is morally wrong and all of that. So, yeah, thanks for watching.